Hello, and welcome to the Hilo Podcast, brought to you by the ECW Podcast. This is a series in which we spoke with patients, doctors, nurses, and the front office staff at Grove Medical Associates in Auburn, Massachusetts, and chronicled their progress. Our host for this series is Amber Asaro, and welcome to Episode 2, The Problems.
From the beginning, when we initially approached the practice with the idea for this project, they immediately knew they wanted to focus on high blood pressure, diabetes, and weight management. Most of us know that these are national health concerns, and ones patients have been encouraged to pay attention to between their office visits. But many listeners may still be wondering, why did we pick these conditions for the Home Health Monitoring Project? This question was answered by Dr. Steven Steinhubel, a clinical cardiologist and the Director of Digital Medicine at the Scripps Translational Science Institute. Dr. Steinhubel has written extensively on his research and trials that form the evidence base to establish the role of mobile health technologies in the transformation of healthcare.
Well, I think the biggest unmet need right now, and therefore the potential for the biggest impact, is in chronic condition management, which frankly our healthcare system is not well designed to deal with. We're very good at treating acute emergencies and things that require hospitalization, but we don't have an infrastructure to do adequate hypertension management or optimal diabetes management or COPD or heart failure. And we're just starting to look at some of those, looking at novel ways to manage patients and to stay on top of patients' conditions from home, but I think we can do that with conditions like hypertension, so not something as severe, but globally at least an even bigger contributor to morbidity and mortality.
While physicians and patients alike are excited about what technology could do for chronic disease management, some, like Dr. Weinstock of Grove Medical, are still skeptical.
Yes, I was definitely skeptical. Like, are they really going to come? They really want to come and meet and talk? And I would say that the meetings that we've had, just kind of amazed at how people just start talking about certain things and how some people think certain things, they don't like certain things. Just the engagement of the patients involved was impressive, and to the point where I thought, well, geez, in this end, we should find another way to get patients involved to meet and talk, because they really can learn a lot from each other, and that's obviously a different track of how to learn and better ourselves, I guess.
Let's take a moment to zoom in on each of the 4 health concerns. We'll discuss why home health monitoring might be useful in their management, get perspective from a few patients dealing with these concerns, and hear about their own goals and expectations. While final outcomes will be in future episodes, for now you can get a peek at what some of them are discovering about midway into the project. Let's start with hypertension, or high blood pressure.
Yeah. So blood pressure is, in numerous circles, is known as the silent killer. Blood pressure, unlike many other problems we have, has no symptoms. People think, I have a headache, I have blurry vision, my pressure must be up. But the majority of people who have elevated blood pressure don't have any symptoms. And we know over time, I tell patients all the time that number that we look at, the 140 over 90, it means that your heart has to achieve a pressure of over 140 to pump the blood out. And if its resting state is only at 90, so that means the heart is working that much harder to maintain that blood pressure, to get the blood out of the heart to the rest of the body. So when that pressure goes from 140 over 90 to 120 over 80, we know that the heart is working less, it decreases the risk of heart attack or stroke, and most people won't have symptoms of high blood pressure until it's too late, or they have that chest pain, or they have a cardiac event, or they have a stroke. So I harp on patients and try to explain to them that the number is the number, and that's what we need to look at. Being able to track that information, giving that to the physician, you can make changes without having them to come to the office. That's the best part. One patient, Jim, we knew his pressure was elevated. We started to make some changes before things got bad for him. Probably wasn't soon enough or quick enough, but being able to make an adjustment, make a change in the medication without having to see the patient is very helpful and can prevent a lot of bad outcomes, essentially.
Here's another physician's perspective on hypertension. Dr. McDowell is a nephrologist practicing in St. Augustine, Florida.
So what I would like to see technology applied is in just creating more awareness of the patient's current medical condition, and also hopefully that awareness is allowing the patient to question more of why we do what we do and what the importance is of that. It gets them more involved in patient care.
Remember William and Jim from our last episode?
Genetically, I know my parents have always had, they both have high blood pressure as well. So I don't know if I'm predisposed to always have it, but I'd like to find out that maybe I'm not.
It runs in my family. I'm the youngest of 10 children. So everybody in my family has blood pressure that is high, hypertension. We've had heart failure, congestive heart failure is my mother, which is what the side of the family it comes from. And my older brother currently has it, so he's fighting that.
In addition to patients tracking diagnosed hypertension, there were several using the home monitor to see if they really did have a problem with their blood pressure, like Dr. Weinstock had mentioned. Here's Jody, who is a nurse herself, so you'll hear her correct me on my medical terminology.
Mainly, I think, is more related to situational anxiety, coming to the office, that typical kind of, you come in, you had it happen once that your blood pressure is going to be elevated, and you're anticipating it, so every time I come in, it's a little bit up.
That's a thing. That's called white coat anxiety.
Right, it's white coat syndrome, exactly. So, and I normally check it myself. I'm a nurse, so when I'm working in the hospital, I'll check it, and generally, when I'm sitting for like 10 or 15 minutes, it's fine. So, so anyhow, he thought this would be a good way to just be able to track it and really see in my own territory. And hopefully I don't nerve myself out at home, but I don't think that will happen. So, so anyhow, I was on board with that.
And Mark?
I'm just over the 50-year mark, so my body is kind of doing some funky things in the last year. So it's good to know exactly what's happening with my blood pressure and what's happening, what kind of activity I'm doing. I'm in outside sales, so my diet's not always the best because of the traveling that I do, but now I'm seeing some raw data as far as what's causing either me being sluggish or my blood pressure to go up or whatever. So it's really cool.
So is that part really actually working for you, the blood pressure cuff, showing you things that are already helping you?
Yeah, this month I really I'm not changing anything in my my eating habits, my whatever, and I'm kind of just waiting to see how it all plays out, like how it averages out. And then next month, I'll start documenting more of what, or being more conscious of what I'm eating and seeing if, what kind of a difference it makes, to see if it's hereditary or if it's if it's my diet and the way I'm treating myself.
Clearly, high blood pressure is not one diagnosis fits all. Some people have been struggling to manage it for years and want to figure out what factors they can modify to keep it controlled, while others are still trying to determine whether they really have an issue. Others just need to prove to themselves that what the doctor has been telling them is true. Here's Dr. McDowell again.
If you look at the diet, and you see by how much it can drop the blood pressure, and then you look at the chances of having, a cardiovascular event in the next 10 years with different blood pressures, say you're hypertensive, and if with that diet, say you can kind of indirectly show to the patient, look, if your blood pressures come down, which this diet has been proven to help with, then your chance of having a heart attack goes down from this percent to that percent. I mean, and it's just a healthy diet, it's not even a medication. And I think that would really get the point across.
Do you have conversations like that in your visits anyway?
I do every single time, and I'm used to it more so as a kidney doctor because, like I said, the disease I most deal with is chronic kidney disease, which people do not have symptoms until the very latter stages. So I have to start to explain to them about the complications of uncontrolled hypertension, even when they're not having symptoms, and it can be a challenge. And the more education is out there, the better, because I only have so much time to educate patients, and it's good when they see it from different sources. So the fact that I can just pull up some brief summarized data on how controlling blood pressure is important through my EMR is very helpful. And and if you explain it enough and patients are interested, they'll definitely get it and they'll understand.
And then, like you said toward the beginning, instead of waiting 6 months or 3 months until I visit you again to check my blood pressure, and then it is high because I'm nervous and I just walked up the stairs and I'm not relaxed. If I'm doing it at home, I can see more in real time, oh man, that Chinese food, look what it did to my blood pressure.
Exactly. Patients kind of become experts with their own, little medical world. What works for them, what doesn't work for them. What's the problem for them. Absolutely, that'll be very beneficial for that reason.
For example, Jim.
Well, I think I'm a good case study. Well, what happened was my blood pressure was high, so I had, based upon your recommendation, I sent Dr. Weinstock a message saying, have you seen my blood pressure? And he says, yes, I was actually just looking at it the other day. We need to get you on some different meds because you're exercising, but your blood pressure is going up. You're doing everything we've asked you to do. So he assigned me a new medication regimen that I went on like on July 24th, we'll say. And on Thursday night, July 30th, I took my blood pressure, and it was great. I turned to my wife and I said, my blood pressure hasn't been this good in years. July 30th at 11 o'clock at night, I went to bed, and my blood pressure was 128 over 79. So I says, Michelle, I haven't seen these numbers in years. This is great. The new medication's working super, and I'm all happy. I go to bed. 2:30 in the morning, Friday morning, I wake up sweating with heavy pressure on the chest, like I had been swimming all day, and I had pain in my left arm. So I thought I had indigestion because I had prime rib for dinner that night, and it was very hot out. It was during a heat wave, and I had actually worked out earlier in the week where I had done some extra bench press reps, so I thought I had just pulled a muscle in my chest. So, all the symptoms of a heart attack I thought were just indigestion, heat, and I hurt myself bench pressing. I took a Tums, burped, went back to sleep. Everything was fine after about 40 minutes. Woke up in the morning at 6. Everybody off to work. My wife's just ready to walk out the door, and I get that feeling again in my chest of heaviness. I'm like, a little bit of pain. So my wife said, go take your blood pressure. I took it. It was 199 over 118.
Oh, my goodness.
She goes, I don't know if that thing's right. Take it again. Wait 5 minutes and take it again. I took it. It was still 178 over 50, whatever, high again. She goes, that's it. We're going to the doctors. If that thing's not working right, we need to find out. If it is working out right, you have a problem. We go in. Sure enough, they do tests. Everything's negative, but they hold me there for 6 hours. Second round of tests, they find out I had a cardiac infarction minor. The enzymes came back positive. So this outpatient test that I've been in basically made me realize that I had a heart attack, where I was just passing it off as indigestion and gas, and I was going to take the dog for a walk that morning with another Tums and figured I'll be fine. But because I had the blood pressure cuff, I was able to identify that there was a problem.
I asked Dr. Weinstock for his take on this.
Do you think that having the blood pressure cuff at home played any role in his story or made any difference?
Oh, yeah, I definitely, because I think one was Jim. He had been on medication for blood pressure, and he was a patient who came in with no symptoms of being elevated. And he travels a lot. He's a stressful job. So he'd be in the elevator borderline, and he would work really hard watching his salt intake, try to watch, his eating habits, trying to be active and exercising. But again, it always felt like his pressure was probably not where it needed to be, or controlled where it needed to be. And I really think that as soon as he got that cuff, he was much more conscious of it and more aware of it.
Now let's shift our focus to another national health concern, diabetes.
Would you mind talking about why that is such a health concern and how home health monitoring is a benefit for that?
Yeah. No, diabetes is huge. I mean, it doesn't take, watch TV and you see all the commercials for the new diabetic medications. There's no doubt the amount of diabetics in this country is just, it's been exponential probably in its growth, unfortunately. And a lot has to do with diet, activity, and just a lot of lifestyle, the way this country lives, whether it's the fast food, it's the food content, but just the automated style of life where we're not as active as we should be. So sugar is just one of these things that is very problematic, and most patients are aware of it to a degree, but not to the extent they should be. We often in the past have been probably well behind diagnosing diabetes, potentially a year or two, a year late from the time things became a problem. So we're trying to be more proactive and diagnose people earlier. We know when you find someone who's got sugar problems early on, when you make significant changes, whether it's lifestyle, diet, and exercise, it can really limit or prevent further complications. And when people are diagnosed with diabetes, it's equivalent to them having heart disease. It is that much of a risk factor. It's just another way to access information and see how they're actively doing, as opposed to, okay, 2 months have passed, how your sugars. You can make changes in between visits. You can be proactive. And more importantly, I think patients will realize, geez, if I eat this, my sugar goes way up. It forces them to realize the connection from diet and their sugar and exercise. I may eat poorly, have a poor lunch. If I go for my walk right after lunch, my sugar comes right down. So again, it engages them in realizing what their sugars are doing based on their activity and their diet.
We already met some patients who are working on making changes, either to prevent diabetes or control it better. Several of the employees at Grove Medical also took part in the project, one of whom has been dealing with diabetes for years now.
I'm Karen.
And would you actually work here at Grove Medical?
I do.
As well? What do you do at Grove?
I'm at the front desk.
Well,
I'm a mom.
Yeah, okay.
And I just had a brand new granddaughter.
Congratulations.
And it's just wonderful.
Yes. So why did you agree to be part of this program?
Well, let's see. 10 years ago, I had a gastric bypass, and I weighed over 300 pounds. I've maintained about 80 pounds in 10 years. But after, say, 9 years or so, my diabetes is back.
Okay.
And my blood pressure, that never really went away, but, it's creeping a little bit, the diabetes really. Okay. So that's why. The weight's creeping a little, but not more than like 15 pounds. But, when it's something right in front of you, right there, that's helpful.
And then what would you specifically define as success for you? When we check in a month or in a few months, what would be a successful outcome for you?
That I'm using the devices, that I actually am. For me, success would be following through with these on a daily. That's my goal.
Okay.
And see where that brings me.
So while Karen will be using her glucose monitor, she'll also be using a blood pressure and activity tracking device to see how all these factors play together. Here's an early preview of how she's been doing.
Because I kept seeing, when normally, I probably wouldn't be as good with my blood sugar, and I'm, I definitely take my meds, but that kind of thing, I'll wait for my A1C test, in 2 or 3 months from now. Right. So this was an everyday occurrence, and I kept seeing it creep up, and I went to him and I said, look at this, and he said, we got to increase it. So that was good, because he probably would have waited another 3 months.
Yeah. Finally, let's take a moment to look at the problem that is often related to many other health problems, our sedentary lifestyle.
My name is Jack. I'm a software developer, and I spend most of my day sitting in my chair. I'm looking forward to having the tracker to maybe motivate myself to get some extra steps in during the day.
I sit all day, so just trying to be more conscious of, maybe getting up more activity.
I don't have time for the gym right now. It's just too busy, but
we know that people who are not active, who are sedentary, we know that they have much higher risk of everything from diabetes to heart attacks to strokes. It's pretty clear. The data shows if people are active, cardiovascular exercise, 20 to 25 minutes, 3 to 4 days a week, that alone can reduce the risk of heart attack and stroke. Is an important fact that people overlook. And I try to explain to patients exercise is vitally important for many things. Everything from stress reduction to weight control. And you have to find a way to get it into your schedule. You can't. That's what I care most about, is trying to keep people active. We know that people who remain active when they go on, as we all get older, the ones who stay in better shape, who are active more, they do better overall. The piece that often will be overlooked in the day-to-day visit, having trackers and having direct input from patients about their physical activities is vitally important for primary care and the medicine in general.
Many of the patients on this project made strides in their activity. Let's hear from someone who took Dr. Weinstock's advice to heart and is trying to stay active and healthy.
My name is Solo Avram. I'm 78 years old. I'm a retired engineer, specialized in chemistry of food industry. And electronic equipment is my hobby now. I use them for many years and become a hobby now. Then I do a little consulting, but really I'm retired and I'm trying to enjoy my retirement. Do not work too hard.
Solo, why did you agree to be part of this program with Grove Medical?
It's interesting. Like I said, there are two things to it. One is the medical aspect, and I have two things to keep eye on it. One is my blood pressure, which recently is a little higher, and I don't take any medicine, by the way. Then the doctor thinks maybe he should give me some. Then this is one thing. The other thing he insists, and I know is good for me, the fitness I'm doing, the exercise and all this. Then this project came exactly where it should be, especially that I like all this technology, new technology. Right. I was one of the first to sign for the portal with my doctor, and one of the first to put Hilo on my phone and use Hilo all the time. Then when I read about it, I understand that this is exactly what I need. I combine my love for the technology with my health interests.
Okay. Solo, how have you tried working on your blood pressure in the past, and what worked for you? What
yes,
didn't work?
Like I said, I'm a healthy guy basically. Everybody has some things, but I'm basically a healthy guy. I don't take at my age any medication. This shows it. But recently the blood pressure a little, went a little high. It's not exceedingly high. And the doctor thinks maybe I should take some light blood pressure medicine. Then what I am doing, I'm trying to do 3, 4, 5 times a week fitness, senior fitness, which is pretty serious and is not easy.
So for this project, what would you define as a successful outcome?
If I won't need to take any medicine, this will be successful. And the technological aspect, if the equipment will work right, I'll be very happy with this.
Just 6 weeks into the project, here's Solo on his results.
Oh, by the way, I met my doctor for a routine meeting. I asked him to show me on his screen, so my numbers on his screen. Then this makes me walk more, do more, pay more attention to those, and I feel good. I lost some weight and all this, great.
Wow, that's really fast, actually.
Yeah.
Less than 2 months, okay.
One health metric that was not a focus of the project was sleep. Healthcare experts have long known the value of sleep, as summarized by Elise, the nutritionist at Grove Medical.
People oftentimes don't even know they're not sleeping well, yet it affects every system in the body, and it makes it so difficult to lose weight. It affects things like depression and blood sugar. It affects everything.
All of the patients got to choose from several activity trackers offered by Withings and iHealth, or to use their own. Almost all of those trackers also happened to track both duration and depth of sleep. However, in our meetings with the patients at first, this feature was hardly mentioned. There was a lot of new information for patients already, so the attention was given to the new hardware and technology and how to use it for their concerns, such as blood pressure or glucose management or increasing activity. It was therefore quite a surprise during our monthly meetings when many of the patients started to become curious about their sleep patterns based on the numbers they were seeing from their devices, and this sparked conversations and questions and even motivated some of them to make changes.
Sleep's always a topic I actually try to talk to my patients about sleep. You're just in the general, but I have so many patients who will complain of fatigue and being tired. It's a relatively common complaint in primary care. So I'll do the routine stuff, but I'll often ask that. I started asking that question: do they fully change their behavior based on the data they actually saw, not even needing a doctor or someone else to point it out to them? That's always amazing when you see a person making a personal change based on the data they're getting from themselves. So I was definitely surprised at how interested. I mean, I guess not totally surprised. I mean, it's interesting, but people who are interested in their health will look at all aspects. So, being able to track that kind of thing, it only kind of makes sense now that they would be interested in their sleep patterns and how they did.
All of these separate things we were tracking started to come together for me as I saw so many different people working on their unique health concerns, but with the same metrics. I asked Elise about this. Now, the health concerns that we are focusing on in this program, we're focusing on weight loss, managing blood pressure, managing blood glucose. Those all have nutritional and exercise components, right?
Correct, absolutely. The number one diagnosis that I see is overweight and obesity. And when you're losing weight, if you're not exercising, as much as 22% of the weight that you lose can be lean muscle tissue. Whereas if you're exercising, it's as little as 6%. So you're maintaining the muscle, but losing more as a percentage of fat. The fat's not healthy, the muscle is. So that's what we're trying to keep. Exercise as well helps to keep your arteries healthy. So blood pressure is lower, your arteries are more elastic when you have exercised repeatedly. And blood glucose, exercise lowers your blood sugar.
Meet Laura.
My name is Laura. I am a career technology education coordinator for a public school, which is part teaching and part administrative. I'm a mother of 4. My kids range in age from 28 down to 12. I'm a single parent. I agreed to be part of this program because I've had high blood pressure for about probably 13, 14 years. It's well controlled with medication. I'd love to not be on medication anymore. Okay. And recently have been having issues with my weight. 52 years old, and the weight is being an issue. So that's my primary reason for being in the program. I would like to stabilize my weight and get back into some of my clothes that are not very comfortable right now because I cannot weigh 200 pounds by Christmas.
Good thinking, yes.
Yes. I have worked on my weight in the past, but it has not been this difficult to control. So I did Weight Watchers about before I was 40, and that kept the weight off for about 10 years.
Right.
And then I did it again thinking, I got 10 more years, and no, I had 3 months. And I was back to where I started.
And then with this program and with your doctors helping and having the devices, what do you think is going to be different about it?
I'm going to be more aware of the details of what impacts. How much I exercise, but am I exercising enough?
Laura had a lot of different factors she wanted to track to see what would reduce her high blood pressure. A few weeks later, she'd found her answer.
How often have you been checking your blood pressure typically?
3 or 4 times a week. So physically, I'm not doing all that well with the activity, but the blood pressure's good. Well, and I like having it lower because I was at the point with this other, when we first started this, I was at the point where it was borderline too high. So seeing this also helps my stress level, knowing what it's at all the time.
Right.
All right.
That's kind of something I hadn't thought of. So in turn, your blood pressure will get under control from knowing that your blood pressure is under control.
Right. And knowing where I am more frequently than once every 3 months or however often I have it checked.
Just as patients were concerned about the same health issues for different reasons, they all had different goals. Some wanted to understand what raised their blood pressure or blood sugar, whether it was from stress or what they were eating, certain activities or lack thereof. Their top goal
ultimately is, getting to the point where the doctor takes you off medication. That would be ideal.
And I'd love to not be on medication anymore.
To keep me off medication or on the lowest amount of medication possible.
Not increasing medication would be good, and not increasing waist size would be good.
On our next episode,
the thing is, Amber, if you put it on your wrist, okay, it is cumbersome.
Just the tracker itself just started failing, and now it doesn't keep a charge, it's not even working.
My concern would be if we're not getting accurate numbers.
We'll focus on the devices and technology used throughout the project. We'll hear from industry experts on what technology is currently making possible and what we should expect in the future. The patients will weigh in with their impressions and progress as well. As you can imagine, things didn't always go perfectly for everybody.